Back by popular demand, back like we've never left. And on this one, I come with you. It is a beautiful song on the beautiful weather in a beautiful show and a very beautiful radio station that only matters #1 in the Val, and we only also matter in South Africa. Hashtag 36 Thetha Drive. That's where you at. And of course, it is vibes and vibrations, faces and places and actions over captions. My name is Skinny AF Hamulefe.
Atwala ya khiteng hape mabedi kajeno kila bone pekeng ke 26 tsa March 2026 mabedi hle dumela ya dumedisa ngithobi ya the MC o phetso hantle e bona nna ke hantle ha o le mo nathi mo mabedi mono lapeng ka taxi ka bo ra dumedisa wena motho wa sabatsing o jwa o sharp bon ke sharp bo fethu Thadi
ha ke no re hello na magalelo na
Pede buzethi
o jwa Thadi
bona la fola batho
ya
qala
ya
please.
It's not me, it's Mr. TNT, man.
yetsa
Abusing.
oh
Icon guys, not me.
Ona nice manyamala
Guys, it's been 2026. Yo, hi.
o se batla fela ba re mela na wena
2026, bro.
Abona na lona ga tshwana abona na the more di months di change mona life ya ka ya elevate
So what are you saying?
What
What are you saying about this? Remember, you have an iPhone now.
Yeah.
This guy was on how much? Was it 9K followers?
Yeah, 9K.
Yeah, those are like.
So I understand that you really go to step by
step.
So it's sharp. Li scoop se ke tlatsitse se di 5 rand. Mamet, ho pola ke le ka re na lo ena re challenge ane ka di 5 rand. 5 liter re kenye ka 5 liter di 5 rand. Na scoop se ga no sketsi ke qetile ka 2026 ja.
Oh, sledits.
Ana mona ke qetile. And then ke batle ke le balo o ntse ntlo mo putsa ka 2026 ke batle ke le balo because that yena ke ntse challenge mamedi wa Thetha hore mamedi bona se mo sena se fela ha re tseleng dikupu because that yena re qadile ka January.
I was not here.
Yeah. Ke nna 19.
Kwena 19.
Ha lena ke qale ka phisi mara jwale o na le twebanyane mane.
Twebanyane. Ya di ntse front. Mabet. Jole he twana ke dumela na lo yena 2026 a feta man. Ke bona go 2027 ke.
So, o be 5 rand.
Yeah, what is it like?
5 liter.
Skina ka visisi.
5 liter bona ya le fati ntwana. So sala 5.
Oh, wait, just a second.
Is it too late for me to start?
Yeah, bona ntwana nyena ona motho a nkang selemo. Now bona already ntwana skupsaka na sto.
So I can join anytime.
Yeah.
I'm fine next month. I'm in.
Yeah.
I'm in.
I'm
in.
Get a boy.
I am in. 20 rand inside.
Wait, that's o se ya bela ka ba kala tweba spot ntwana.
And the toba yang ka a qete bentlela mazimba. Nna ke tsebo e kile mane jwale ke
wa jawe
o tsa se skupise ka mavimbe tsa ka mavimbe skupise
Sitele ntwana
ya
Sitele plus plaster madla Sitele no chitela o kwala ka tape
Foi no hospital la gente.
For you guys, how are we feeling today? Out of a scale of 10, how are we feeling this afternoon?
I'm 10.
10. All right, yes. Number one. Lena, I feel like I'm on a 10. Kaya 10. What about you, Toby?
Obvious.
Okay, I love that.
Yeah.
Mama is 0630737540. That's where you find us. Now, before we could get into anything else, I just want to talk about something. Ne? There's a video that I saw on TikTok. So Magriza Onana, only a daughter. Ne? So her daughter is like 17 years of age. So people are bashing this mother for allowing the daughter to attend the baby shower. High. So obviously these kids are in the same age group. They're also in the same age and they're attending the same class at the same school. So parents are saying, how can you allow your child to attend another child's baby shower? You understand? So there's actually speculations on TikTok, people saying that you are actually a part of the problem, your teenage pregnancy, because if it was my child, I was not even going to think about my child attending the baby shower.
How do we
think about that? Was 17.
Yeah.
Then that was 17.
Yeah.
Yeah, man, it's manje tata.
If ke mistake, mara aska.
10 grade 11, dog. 10 grade 11.
Yeah. But then
how do you that? More especially singamle. How when it is skin. Sheba bana ba mangam lantwan. ba shebe ntwana like ngwana 17 years in fethu tla thola le hotman like ha bona dirito jolo ka hotman a kenya girlfriend ya ba etseng mosebetsi so batho ba no jo teng fethu ha ba ska ba jaja ntwana we listen don't judge batho ba no fethu ba phela singamla o se ken ko fethu
But Blue Ivy, how old is she?
Blue Ivy is young. Blue Ivy is too young. I think Blue Ivy could be 13, 14.
I'm not so too pregnant, and they're so happy.
But is she?
botsonto ke ma ke tsotso ka pokema ba ba dirang Facebook ba ba rekang dikoloi be couple engwe nyane blind
But Alzaga, dog. As a parent, you see one at 17, dog, baby shower. How was the baby shower, Macha? How was the baby shower? How was the baby shower? But Fetsu, it's one of the things that are happening in Razwagala with so much more on the entertainment world and whatever that you might have missed on the news. Stick around and find out what we have. By the way, just tune in and obviously tell your friends and your aunties that we are back on air, baby. It is #36 Thetha Drive. Mind in, send in your voice notes. Serela Garandao. Officially, we are in the building. Good afternoon. So we would say on a normal basis, taking us to the hour where we talk everything that you might have missed, including some entertainment news. And hey, Buffett, enough for me. I don't have quite a lot of stories, but one thing that I have on my side. Hey, okay, there's a song I want to play. And the song, guys, we're gonna cry in a few minutes now. This song, bro. I was listening, dog. On TikTok, when you're listening to the song, people are, man, they feel it. And I give myself time to listen to the song. I'm like, So I want us to cry together. Just after talking about the news, just after talking about... And I want my Nyamala to be the first one to cry. Because I know if she cries first, I'm safe. If I cry first, it's going to be a joke. So I want you to cry first. But it's one song that I want us to listen to. I think it's new. It's been added a month ago. But the first story that I have, Mabane Rubileka DJ Simza.
Yeah.
As he's returning on a popular radio station. So this is sparking quite a lot of debate on social media. Ne? And then people were not ready to sync it yet. Now that they have synced it, they are complaining. They are complaining, dude.
But numbers bona Wi-Fi.
But Wi-Fi is numbers, man. You are very young, very talented. We have young unemployment in South Africa. And then you're going to hire a multi-millionaire. Man, make it make sense.
Bana le merero ka motho. Bana di goals ka motho. Batho ba no ba nka re money je. Batho ba ngata mamedi ba lela hore hobaneng banka DJ Shimza ele a multi-millionaire. Talente le teng strate. Mara nna ka e sheba ka lihlo la kgwebo la business hore batho ba qetelletse banka DJ Shimza ka lebaka la hore ba tseba hore this guy on a lead numbers. Yes, re na le tsona. Let's say re fella 100. Mara na mano tlo go beya ho 300.
So business wise it makes
sense.
Yeah.
Remember radio ntwana it's a business. Aske ga shebang radio ka di hlola gore eng kae. Batho bana fethu ba banka o shebe checka le metro. Ho tletse di celebrity da. Bo swemizi ba spana da. Bo la meze DJ.
People are no longer.
How many voice sa bona o tloma na batho ba mara ba monate ba. Emona o tloma na batho ba mfethu mona nka ba shapa 10 no twanga kena da. O ntlo sina ka kena ka ba shapa ntho ya emona ya uqhuma boroko.
But that doesn't matter.
Bona ba ka di numbers. O swemizi ka mqova ka mkenya hithetha. O tlopisa
I feel like dog. No. I don't care, dog. Like right now, radio doesn't make sense anymore. People are now watching podcasts instead of listening to radio because of such pure talent that it's lacking on radio. You understand? There's no point for me to listen to a multi-millionaire, but when they utter words, when they are on air, it absolutely make no sense. I go with, I understand what you're saying. And quite a lot of businesses, they do that in radio.
Yeah, business radio.
Do a podcast, not radio. We still rely on radio for information. We still rely on radio for talent.
Yeah. Mara le nna to be honest ne ke mo makaletse DJ Shimza ba fetho spana mnate una le chelete ya una le business time o batlang lo spanela motho
and now wa sheba ba fitla radio tseo tsa bona tshwetse ba di etsang ba tlisa personal issues a ke sentse re ba tseba ha mang o tshilo ka mang. It's like a podcast ma ke radio gona ga batla o tseba go
tsala tsohle ke di bona kaofela nana life mo mnate una le business tsa o DJ o kgona ya mose o kgona ya Europe lo dlala dane. No, so hiriwe ba batla 9 to 12 each and every day. O so le under motho. o so le under pressure o so sebeletsa motho o na le tšhelete ai shimza o batlanda
they must be paying him well, eh? They must be paying him well.
a ka me ha go le ena twana e mo motho o na le tšhelete
Bulang menyako.
ha ba twana motho
bula
e mo
menyako,
ba shimza o tsana le tšhelete fetho hona le event tsa dietsana tse kgolo le ke ha o shebile event e teng e tsala Cape Town o ka tshwere tsala Europe o ka tshwere tsala Dubai
Yo kunye.
kunye ya kunye hona le event e bitswang kunye wa ikafa yes
It's big. One of the
yo
biggest
very
African
very big
events.
e mona da fetho tla manga mola fela ho tla bo black coffee there ho tla bo pina tsane tse fast there ho tla thongwe ke ha ida idenyiwe so na hana ke taba ya bo spanning DJ Shimiza ya spanning o spanela motho
They must be paying him well.
ena motho na di company tse sa go ditse ka mabitso
Ka mutlanto a ona teng se why are you late Shims?
wa bona
Boss. Skisi boss.
sorry boss
Yeah, it's one of the things. And the second story that I have,
Yeah.
it seems like Camilo Robala Sponisa no. I think Sponisa Sibasa Ifinyana Bafit. 12 police officials have been arrested
ke bone
in connection to the 360 million rents tender that was awarded to Ket Makala.
ke bone
Yeah, but the space is hot no. Attention! Global! Get that is! Yeah.
bana se ga nnete
Arieng!
Afrika borwa ai ba shapa crime
Ha.
ai tjotjo ba shapa Afrika borwa tletse ka tjotjo e se nthotlala le maponesa a tshwarwa mo mamedi ala baka la manyofonyofo a etsalang di ditsotsi
That's bad.
ba ka
O
hare
parliament qosa o mong ba mo qosa ka morao o mong
bad.
a batlang a commission o botsa wana a tlo qoswa
Ke eng ha ba kgonesha?
like
Ba
it's
kgona.
hectic.
why ba ikenya ka ga manyofonyofo mfethu ka ga di crime
Nkare drama
I think we have
nyana, man.
inherited we have inherited this thing called corruption. We inherited this thing
yo
because now it's rotten. The whole thing is rotten, dog.
e mona hona le shop e mo ke sa batlong bitsa ka lebitso ya nama mamedi re ke sa nama da sisterelo ke a go honna if o batla piece tse di batlang tseo kenya 5 rand ka godimo ke 5 rand ya ma obvious mfethu etsa apply
Nana, you lose your job because of 5 rands. You lose your job because of that 5 rands.
ene hona mo hape ba rekisa dading e le reng ke lalaza ka se be bitsa lalaza ka ba bitsa ba e rekisa dading wa
Let's work on that at a time.
ba e rekisa ba ntsha ka back door o tla ka 20 liter
Bye bye, I think
Yeah.
it's for free, bruh.
ntwana mzanzi mfethu
I thought it's free.
mona no ntwana ntwana ntse tsala mzanzi no.
Masala for a better like over it.
Yeah, like
Masala
dading eo
is crumbs.
ke mafura le ntho mafufuletsana ana masanetse a saletseng panene then ba khigile o tla ka 20 liter o tsela ka da then wena o pada mo 40 rand wa reka ntho
Ene ke sharp.
then obviously ke go lelo letsa profit of hlakasi we rekisa bana ba
Yes.
ba isa bana ba skela ba tsama ba kula le kula because of nahana ke mafura a khodinyane ya jen match
Expired.
wa understand so emona ntho tse emona yo jojo hi it's everywhere
That story that I have, let me surprise you. But this is not a surprise. I think you all saw it.
yeah
This is crazy.
yeah
I think people are sick and tired, Buffett. There's a I don't want to say this name, but obviously we know like party thing. It was on social media. So Bavile somewhere on a township.
yeah
Balo campaigner. And abashapa kama botolo to.
baba shapa ka motlo
Ooh, yeah.
esa
That guy's like amandla but awekho.
awekho
Awekho. It's trending now. Awekho.
aseluwa bathi awekho ngiyantwana ngibonile ntwana le ene ngiyibona hanyana ka ifita bona le mbeki post ku WhatsApp mona nje bathi amandla community ene awekho ena amandla ne awekho
Give that guy a juice.
awekho
We are tired, guys.
I'm sorry.
We are sick and tired of being sick and
No,
tired
I
of this
work
country, Buffett.
emona tse ding hape hona le building e chileng ka sia ntwana Eastern Cape umthatha o bona
Yeah. Yeah, I saw it. Ngase
emona e chile ha bohloko kore e chile mfethu because ha ke thola ke shaba ka re affectile di room tse ka bang tse 11 and e qadile 8th floor number 8
yeah.
That's bad.
amana yo e mona yo ibile mollo o mong o tshosang o kana hanang lo yena wa bona hore ya mona hona batho ba senyetsweng ke dintho tse bohlokwa mo
And the more no dula batho ba sebetse like nkare
Ah.
company
Yeah.
like go to reclusite ga lo be mo.
yeah
Yeah, so hana jale ba zamme e plekenyana hore ba be for mara ba tswele pele ka
wa
Spanish.
fitwe ke mollo
I so hlai hantle.
o thola gore ke skin o bohlaswanyana o sila le candle le ka ra gapela
It's a
e tshwara ga teng go tšhisetsa building kaofela bona motho a le metsing yes ke yona fela ya mare e mona ntho tsa batho di chile mfetho ntho tse important tsa batho e etsa itse mane Eastern Cape
I mean, I'm just hopeful hore wa bona king ba tla ba sharp bafethu. Hopefully they'll be fine. Beautiful Thursday afternoon at this hour. You know what time it is. We talk all things health with our guest in studio. And I just want to emphasize that today's conversation is a bit different. We're talking about motherhood. So whether you're planning to have a baby, you're currently expecting, or simply want to be informed, this conversation is definitely for you, because we know all of us that pregnancy is beautiful, but however it also comes with a lot of questions, uncertainties, and obviously sometimes even risks if not handled properly. And to guide us through this conversation, we are joined by Sister Mabuntle Ndungwe. Good afternoon.
Hi, afternoon. How are you?
I'm great, thank you.
I'm
Welcome
good, thank
to the
you.
Beauty 6 Thetha Drive.
Thank you.
Thank you. Now let's get into this today's conversation. It's about pregnancy. It's about motherhood. Is there a good time for pregnancy, or it really doesn't matter?
It does matter, but you can't say for certain when is the right time for pregnancy. Own choices and their own stage in life where they are ready to fall pregnant. But what's most important is that before you can fall pregnant, you need to be ready. You need to be physically ready, as in you are mature enough. You are not young or too old. You need to be financially ready. You need to have a good support system, because pregnancy comes with a lot of things. You know, it comes with minor ailments, big ailments. It comes with a lot of stress looking after a newborn and all of that. So you need to be sure that you are ready for this particular pregnancy before you can even try to fall pregnant. Yes.
Now let's talk about planning.
Yes.
To have a child.
Yes. So planning starts on that day when you say, baby, let's extend our family. When you start to have that conversation, you need to also be starting to see your gynecologist. You need to start with the gynecologist. So that's the process we call preconception. It's a very important process that usually we miss, but it's very important that you start with preconception, whereby you go and find a gynecologist. You talk with your gynecologist. You find what are your risks with being pregnant. What are everything that you need to look out for. We test you for everything, like your HIV status, your sexually transmitted infections, your high blood, your diabetes. They check all of those things pre-pregnancy, so that when you fall pregnant, we have the baseline, so that they now happen. We know that, we started here, so these are related to the pregnancy. They are not because you were sick before, or if you were sick before, maybe you were on treatment. Let's say you were on chronic medication. So almost all of the chronic medications you need to change when you're pregnant.
Is it?
Yes. Like your hypertension medication, for example, your Redac, you don't take Redac when you're pregnant. They change it to more hypotone. Your Epilim for your epilepsies is changed to Tegretol, which are more pregnancy friendly. So those are the things you need to discuss with your gynae before you fall pregnant. Yes.
And most times, I know this doesn't come from any offense, but in most times, from our experiences, because I'm not really, plagued. Like there's a lot of kids everywhere. Don't even think of such things. So how would you professionally advise us the importance of having to go through these processes? Why is it important?
Okay, so now you have to know your periods. So you need to know your cycle. You need to know when you are ovulating. Check that you have your periods every day. Count your cycle. There are apps now to help you with that. Count your cycle. The minute you miss your period, go to your doctor or go to your clinic, anywhere where you can get assistance, so that all these things can be checked out and proper management can be done in the first few months of pregnancy, because everything happens within the first 12 weeks. The baby is fully formed by the first 12 weeks.
Okay.
And then after that, it's just the growing part of it and maturing of the things that are there. So if you missed it in the first 12 weeks, that's where all the problems will go wrong.
What kind of problems would you, maybe, even if you don't get deep into it, but what would be expected of such problems?
The problems that will come with not attending antenatal clinic. It will depend. Is it physical problems, or is it neurological problems or anything, then the doctors will advise. It could be either maybe the doctors might advise for you to terminate the pregnancy if they are severe, or they will advise after the baby is born, this is what you can do to make the child's life a bit better.
Sure, this sounds very important. This is my first time hearing of such healthy pregnancy. And can you just elaborate a little bit deeper into what does healthy pregnancy look like?
So a healthy pregnancy, an ideal pregnancy, it's a pregnancy without morning sickness, a pregnancy where you don't have swollen feet, swollen nose. But there's no ideal pregnancy. It goes with, people are individuals, but you would want to be healthy in terms of you don't have any chronic conditions, like you don't develop your high blood, you don't develop your diabetes. The swollen nose comes with it's the hormones.
It's natural. Is it natural?
It's
Oh,
hormones.
okay.
It's hormones. It's not for everyone, but it's
Sure,
hormones.
sure.
But you would want to be healthy, you know. Even the vomiting, it comes, it's a package with the pregnancy, but there's excessive vomiting, which you will then need to be admitted, get IV fluids and all of that. But the normal vomiting, you can just treat by maybe taking your ginger biscuits or your dry toast. Then that would be ideal.
Okay, I think you've explained it. I think you've explained it very mouthful. So now, what would be complications within pregnancy? What do complications look like during pregnancy? If someone says I've had complications.
Oh no, there's a lot. Starting from something as minor as vomiting, like I'm saying, there's excessive vomiting. Something as minor as vomiting, you would think I'm just vomiting because I'm pregnant. But then when you can't keep anything down, you are eating and it's all coming out. It's a condition we called hyperemesis gravidarum. So it gets so severe that you are losing weight, you are losing your electrolytes. You need to be admitted for IV fluids, for rehydration. It gets so complicated at times. Sometimes it's just very bad. But then it's something as simple as that, vomiting. And there's something as worse as hypertension. High blood, it's the worst thing you can have during your pregnancy, especially if it's not controlled properly, because it will depend on the stages of the pregnancy, how it is managed and how it is presenting itself. So usually with people, you miss that you have high blood. Like they will be saying that high blood is it's a silent killer because it doesn't really have signs except for your headache. So most people ignore those headaches. You'll be taking their grandpas and all of that. You ignore that headache, but it is the high blood itself. So it depends on what stage of your pregnancy the high blood pressure shows and how it is showing. So when it starts having multiple organs involved in there, you're now having your headaches, you can't see properly, now your urine is so dark and there's a lot happening there. It becomes very severe. That's when the doctor needs to deliver you. It doesn't matter what stage you are at. It could be as early as 26 weeks, could be late as 38 weeks. So it will depend the severity of it, but usually the doctor will need to manage it by delivering you.
What would be the next, or what would be something a mother would do if they feel like they're having such complications during their pregnancy? What would you advise in your
Go to
profession?
the nearest hospital. Go to your nearest hospital. So you need to consult your doctor or come to the ward itself. So there are midwives there 24/7 who knows what they are doing. We are in constant communication with our doctors. So as soon as you feel unwell, sometimes you can't pinpoint what am I feeling, but you're like, I'm not feeling so well today. Rather come to us, let's check you out, let's check your baby, and then just reassure you and call the doctor to see you. We have an ultrasound in the ward. The doctor can come and check, is your baby okay? He doesn't need to go now at night to his rooms to open the rooms just to check if your baby's okay. We have an ultrasound in the ward. He can just do that and check you quickly. But if when you get there, the midwives are so worried about you and the doctor is a bit far, there's a casualty officer who can come and assist quickly. Yes.
I think another complication, and I think Sister Ndinga will tell a little bit more on that, it's bleeding while you're pregnant.
Yes, bleeding. Yes.
Take on that.
Yeah, bleeding, it's one of the other complications. So there's major complications that can lead to more things happening. So bleeding is one of that. So remember, when you like I said in the beginning, that when you miss your period, you immediately go to the doctor and check if you are pregnant. So that will be the last time you don't see your period. Sometimes you don't miss your period, you just have 2 days instead of your 4 days. So that's also a sign to try and see what's happening, because if you're used to having your 4 days, normal menstrual period of 5 days, and then all of a sudden you have 2 days, just go and see. But that's where it should end. You shouldn't have any bleeding again in your pregnancy, not at all. You shouldn't be bleeding at all. You shouldn't be spotting. You shouldn't be having any of that. So there are causes of bleeding that can happen. It could be because your placenta is low. So that's we call placenta previa. So the placenta is there on the mouth of the cervix, or just so close to the mouth of the cervix. So it causes some bleeding, which the doctors will pick up during your visits to the doctor, and they will advise you to bed rest, to rest as much as possible. Or it could be because of another complication of that high blood. So we call that placenta abruption. So placenta abruption is when the placenta separates early. So you're still pregnant, but the placenta separates because of this high blood. So now you start bleeding. And then it could also be because of a trauma. Somebody hit you on your stomach, or you fell in your stomach or something. So if anything happens around your stomach, just come so that we see what's happening. So you shouldn't be bleeding at all during pregnancy.
Sure.
The only time you should be seeing blood is when now labor is starting. So there will be that mucus plug, that mafinela kind of vibe with blood. We call it show. So that's a sign of labor starting. That's the only time you should be seeing blood. Otherwise, you shouldn't be seeing blood at all during your pregnancy.
So this hospital. So in a nutshell, the hospital does have space for pregnant women to even give birth in.
Yes.
All right. So now, which options do I have now as a pregnant woman? Now that you have doctors, now that there's a space for me to give birth, which options do I have
For delivery.
for delivery?
Okay, so because whether you want a cesarean section or a normal vaginal delivery, it's something that you discuss with your doctor, and the doctor will see how they discuss with the medical aid. So if maybe it's your first child, there are no complications, your baby is fine, coming head first, and everything is going well, the first option will be to deliver normally, and then the doctor will decide whether we are inducing the labor depending on how you are presenting. Let's say maybe you have that high blood I was mentioning, but it's controlled, or you have your diabetes, it's controlled. The doctor will then decide, let's induce. We don't really wait for the full term itself. Let's induce and take out this baby, because we don't want this condition to get worse. While we still have it under control. Let's rather induce, or they decide to go for a cesarean section depending on how is the baby presenting. Maybe it's a bridge delivery, baby is coming bum first, or the baby is coming on the side, which is a transverse lie, the baby is just lying like this, the head is here, the bums are here. So that could be another option for a Caesar. Or the baby is too big, and the mommy is tiny, and the baby is too big, and when we check, this baby cannot really pass here, the doctor will decide. So it's the doctor who takes the decision in discussion with the patient on how to deliver the baby.
Sounds scary.
No, it's not.
It's not.
It's really not.
So is there, I saw a video, just out of context, but you're still here. I saw a video of a particular public figure. She was giving birth. And it seemed like she did not experience any pains, any labor pains.
Lucky her.
Is that possible?
Lucky her.
I just wanted to know, is that possible? Is it an option like that? Because, it's a private hospital.
So there are things you can give you for pain relief. To help ease the pain.
Okay.
But we do need pain. You need the pain to push.
It's a thing.
You need to have pain to
Oh,
push.
okay.
You can't push without the pain. But
Okay.
there are things to make them,
Okay.
relieve them a little bit.
Right.
Yes.
Now you've explained it. So you mentioned, you did touch on the medical aid when I come to the hospital. Now let's say I have cash. How much would it be estimately if I want to give birth at the hospital?
Okay, that's where I come in. So we've got, like Sister said, 2 different birthing options. So for your normal delivery, so you either be in the hospital for 2 or 3 days. So for 2 days, it's 20,400 rand. For 3 days, it's 24,300 rand. Should you then be a candidate for a C-section, so for 3 days, so C-sections obviously because it's a prolonged stay, so it starts from 3 days, and that would be 31,100 rand. And for 4 days, should the doctor decide, no, we still need to see and observe you more, 4 days is more like your cut off, is 35,400 rand. Yeah.
So for inquiring about these prices, these days that you've mentioned, who do I speak to?
So you call the hospital. People can also speak to me as well on my WhatsApp number. But I must just also indicate these are just hospital fees. So it does not include the doctor's fee. So the doctor will charge you separately. It does not include the pathology fees. So your bloods, because you still need to have your bloods done. And radiology, should you need to go to the radiologist. But usually with pregnant women, they will be seen by a obstetrician and gynecologist who have sauna machines in their rooms. So whatever it is they charge you would include for your sauna, the examination and the sauna machine, or the sauna, what do you call it, checking of the baby through the sauna. So it's part of a package that they would have. I know we have doctors that are charging between 1,000, 1,004 for that, which includes examination, like I said, consultation, and the scan as well.
No, that's mouthful. That's mouthful. I think this also goes to you as well. This question that I have, would you? Because you did mention something like healthy pregnancy. My worry now, it comes with age. Because you do mention that there's particular stages where you'd have complicated delivery. Now, with so much high teenage pregnancy that we're having in South Africa, as a sister, as a nurse, for a better lack of word, how do things look like now when you are helping to deliver such babies? Is it something that's risky? It really does not matter on the age? Can you just elaborate just a bit on that?
It is risky.
Okay.
Remember, they are still young. Their bodies are not mature enough, but we are there to assist them. So the doctor with the parents of the young lady, they will have that discussion on how to deliver this baby safely. It still does happen, as much as there's health education out there for everyone, but it still does happen that we still have our teenagers that are still falling pregnant, but our doctors usually have that communication with the parents on how do we do it safely for them. Yes.
Now, there's something that I've heard about giving birth. Ne? It just, fix me on that, correct me on that one. It says that men, particularly most of the times in public hospitals, they're not allowed to get into rooms when the mother of the child is delivering, is giving birth. So now when it comes to clinics, do their partners allowed to enter the rooms while the mother is delivering the baby?
Yes, so with us in maternity we have longer visiting times unlike the rest of the hospital, because remember we are starting families there, so we want people to see their new members. So our visiting times are from 10 until 6 in the evening. We allow two people to come in and out all the time. But then for this particular lady that is laboring, about to deliver, we allow it to extend far beyond 6 o'clock. So the partner is allowed to be in there. We do have those comfortable sofas for the partner, so he can rest there as well. And then we have those bouncy balls for the mother to relax and allow labor to progress. So we do allow them to stay, but after the delivery of the baby, if it's way after the visiting time, we do give them that at least 1 hour allowance for the father, just to be happy that my partner is okay, the baby is okay, and then they have to go. So if it's late, we can't chase you out of the hospital. It's late. We do have the waiting room in ICU and the waiting room by neonatal. It's sofas in there. You can just give the partner a pillow and a blanket just to sleep overnight, and in the morning they can go home.
No, I love that. I think I love that option. Now, in closing, what advice do you have for first-time mothers?
Oh, first-time moms, they must come to my antenatal class. People that come to the antenatal class, when they go to the ward, it's so much easier. They have the information, they know what to expect, because I think this not knowing what to expect, it's the scary part of it. So we are very out there in that antenatal class. You tell them this is how you push, this is what we'll do, all of these things. So it gets easier. They are much more relaxed when they get to the ward, because they don't really, as much as they watch YouTube and everything, it doesn't click that this is going to happen to me. But when we are in that antenatal class, I show them this is how you push, this is how you hold your legs, this is all you do. It gets easier. I find that when they get to the ward, they are very relaxed.
No, I love that. Thank you so much, Sister Mabontle,
Thank
for
you.
actually giving us such insightful knowledge on pregnancy. And right about now, we're jumping and crossing over to the friend of the show. Her name is Miss Kensani Shomani. Welcome to the show, but I know you've been welcome.
Thank you so much. And just hello to the listeners. So what we're having for what's happening in the hospital, I just wanted to speak a little bit about baby clinic. Now that we're speaking about pregnancy and so on, obviously when baby is here, then what? So we have a baby clinic in the hospital, and it's 150 rand for immunization. And this is for any other babies that are there. So they don't have to have been babies that are born in the hospital. So whether babies were born in a public hospital, we just charge 150 rand as an admission administrative fee. But babies get their immunizations, there's a card that you get. But I think for our mommies that are giving birth in the hospital, the first immunization is for free, right? And then they get the baby book as well, so that they're able to bring in baby. And I think it goes on up to, 6-7 years? 12 years, right. And then we have the antenatal classes, the one that Sister Mabontle was speaking about, to say please come and, and have a conversation with her in terms of, what to expect when you're in labor. And the class is happening this Saturday on the 28th, and this will be from 9 in the morning until 12, right? And that is what's going to be happening in the hospital. Also, the clinic also caters for people that want to do family planning. We just alluded now to teenage pregnancies and so on, but we also assist with family planning. If people want to come and they feel they're not ready to fall pregnant as yet, and I want to plan, so we do offer those services as well. People can come and have their family planning at the hospital. And then we are also going to be at Everton Mall to do the mall activation. This is on the 28th, which is the Saturday, from 10 until 3. And yeah, we're going to be doing screenings. So it's the BMI screening. We're going to do the blood sugar screening. And I have a partner, Lancet, that is coming on board as well, and they're going to be doing the cholesterol. So we're going to be checking your cholesterol level, fat level in your blood. And we're also going to be doing the BMI as well, because we still have issues with obesity and so on. So yeah, that is what is going to be happening. Again, we do deliver medication from the pharmacy. Pharmacy is open from 8 in the morning until 8 in the evening. And like I said last week, we're now delivering medication, especially a chronic medication, to people who want the medication delivered. So that's more or less it from my side. How do you get hold of us? We've got a WhatsApp number. The number is 079-515-2393. I'll say the number again, 079-515-2393.
Thank you so much.
When your health needs more than just a quick fix, trust Clinics at this private hospital.
I was born to be free.